Hi, this is Dr. Ty Vincent, talking about low-dose immunotherapy again. This time, let's talk about what's going to happen after our first visit and when you're going to get your doses sent. And like every time you need more doses sent, this is kind of how it's going to go, how to keep track of them and store them and all those sorts of things. So after we decide what doses we want to send you, you will get an email sent to you by Jeanette from our usual business email. It'll have an invoice linked from it. So you're going to follow that. You're going to look at the invoice. Always make sure that your shipping address is correct, especially if you live in more than one place during the year and we may have more than one address for you in the account. Always make sure your shipping address is the right one or your box will go the wrong place. Make sure that the dose list is what we talked about. So I will try to, in an email or during our discussion, I will tell you what doses we plan to send. Write that down or refer to the email and make sure that it's the right dose list. Because once you have approved all that and you pay for the invoice, then we're going to prepare what's on the invoice and ship it to the address that's on the invoice. So if there are any mistakes, that's your chance to catch those things, okay? When your doses arrive, you're going to have a collection of little syringes. So insulin syringes, they're pretty small. The needles are cut off, but the caps are put back on. So each one will have whatever that dose is or a collection of antigen doses in the syringe. They should match what's listed on the invoice. You'll get a paper copy of the invoice in the little Ziploc bag with it. Make sure that you have the right syringes, you can read the labels, make sure that there is the right amount of fluid volume in each one. So a standard dose, if there's no change in volume, will be 4 units of liquid, which is only 0.04 milliliters. It's very little. It's less than 2 drops of liquid. That's all that's in a dose. So if you get it and you seem like this can't be right because there's just a tiny amount of liquid, it's right, that's all there is. You're gonna take that and you're gonna take the cap off. You're gonna squirt the dose under your tongue. So make sure the tip of the syringe is past your bottom teeth and beneath your tongue, and then deposit the drops. Don't hold it outside your mouth and shoot at your mouth because you may miss. When we cut the needles off, sometimes they get crimped or bent a little bit and it doesn't necessarily shoot straight. So make sure that it is under your tongue and past the teeth, deposit it there, and then you'll be fine. You can close your mouth and just kind of hold it for 10 seconds, 20 seconds. It doesn't really matter. The length of time is not that critical. It just really has to make contact with the floor of the mouth first. That's where the immune system cells are that we believe are the target audience here that need to be taught tolerance. So just get it under there. A few seconds is fine. It really doesn't matter if you've eaten, brushed your teeth, had alcohol, mouthwash before or after. It really doesn't matter. With homeopathy and homeopathy remedies, people treat kind of similar to this. There are all these rules about eating, drinking, brushing teeth, chewing gum, whatever. None of that seems relevant with LDI. It's probably not relevant with homeopathy either, but we don't tell people to worry about any of that stuff. So you're gonna put your dose under there, and then you're gonna wait the number of days we tell you, give it about a week usually, judge the effect of the dose, and then send me a report. I'll have a separate video on dose reporting. That one's really important to watch. As far as storage of the doses goes, you don't have to refrigerate them. They don't have to be kept at any particular temperature. If they freeze in your mailbox, that seems to be okay. If they're 120 degrees in your mailbox, that seems to be okay too. They don't seem to have an expiration date. They don't seem to expire as long as the liquid is still in the syringe. What can happen, that will happen over time, depending on how humid it is where you live, is they will evaporate. So if you have syringes that sit around for a year or more, there's a fair chance that some of the liquid will passively just evaporate out of the syringe. And that happens, like I said, it takes a different length of time depending on where you live, 6 months minimum. And if you're in a pretty humid climate, they'll last a year or more usually. So if you have old syringes, you want to pull them out, just look and make sure that the liquid is still full in there. One thing I will tell you is that air looks just like water. It just looks clear. So if you have a completely empty syringe, it looks basically the same as a completely full syringe. If there's part water and part air, you can see a line, and what we call an air fluid line in there. And you can say, oh, there's only 2 units left instead of 4 units left of the dose. So if it looks full and it's old, what you should do is pull the plunger back a little bit and then make sure that you can see a line between air and water, and then oh yeah, there's 4 units of water there. And you can use it. If you pull that plunger back and it still looks the same, then there's nothing in there anymore, no liquid. So that's something to think about and to check when you have old syringes that have been laying around, or if you're just not sure and you want to check them. Because every once in a while, a syringe will arrive on your end empty. If we are not careful and there's a little air bubble left inside with the liquid, when they go up in the airplane at altitude and they don't pressurize cargo planes, that air bubble will expand and it'll squirt all the liquid out of the syringe. And so you can occasionally end up with an empty syringe that looks full. And then people just push it under their mouth and they think they didn't feel anything and they're not sure. So if you want to just make extra sure, take every syringe, pull the plunger back a little bit and make sure there's an air fluid level at about 4 units of volume. Or if it's a larger volume dose, after we've titrated for people and we've found their dose adjustments, sometimes they have 5 units or 6 units or 8 units of liquid. If there's multiple antigens in the syringe, there'll be larger amounts of liquid. So just make sure that there's liquid all the way from the plunger to the needle. Pull it back if you need to make sure that there's an air fluid level, and just be safe with that.